4 minutes after the hour, we're joined by our friends from Donahoo Physical Therapy. Ben and his son, Evan Donahoo, joined us this morning. Gentlemen, good morning to you.
Good morning.
Good morning.
Go Wolves, right?
Go Wolves.
Go Wolves. That's
Man,
awesome.
oh yeah.
A great day for
Listen,
them.
talking about exciting times, you guys have announced you got some exciting times coming. You're kind of expanding a little bit, Ben.
We are expanding. So we're recently had an opportunity to put a clinic in Vincent, Alabama. And so we're excited about that. It's in the process. We're not actually treating patients there yet, but hopefully sometime in June, this thing's going to get off and get started, and looking forward to helping the people in Vincent, Harpersville, Columbiana.
Talk about this young guy to your right there. Who is he?
Evan Donahoo, a recent graduate 8 months ago from a doctorate of physical therapy program. And he's been with us for 8 months, and he's sharp as a tack.
He's pretty doggone good. He treated me earlier this week, and took me 2 days to recover from that. But he gets it done. I'll tell you, Evan. Good morning.
Good morning, Jimmy. How you doing?
I'm good. Talk a little bit about, Evan, where you been and opening up that new facility. You're going to be over there in Vincent, right?
That's right. Yeah, I'll be the main provider down there in Vincent, serving the area. In regards to where I've been, I graduated from Auburn University, hometown Sylacauga. I went to PT school in Mississippi, and I graduated, come down here and work with Ben, and I'm excited about expanding the business.
No doubt about that, for sure. And whether the folks watching are armchair quarterbacks like me, or they're athletes, Ben, you can treat them all, right?
We treat them all, from 6 months to 106. We treat just about anything and everything, and any kind of pain, functional disability. If you got problems doing something or have pain doing something, we can generally help you out with that.
Now, how does this work as far as maybe people are watching this morning, they've got some aches and pains in their shoulders or their hips, or maybe they've had total knee replacement like me. How does this work for you guys?
Well, you would... before recently, you would have to have a doctor's referral. You would come in, a doctor would refer you to physical therapy. You'd bring that referral in, we get you set up, pre-search your insurance, or pay cash if that's the preferred route you'd like to take. But now we have a direct access here in Alabama, so now you could just pick up the phone, call the clinic, and get scheduled, usually within a day or two.
So, Evan, you don't have to go through a physician? Is that right?
That's the case, Jimmy, yeah.
Wow.
So you just call in and schedule, we'll get you on the books for a 30-day period.
Yeah. And whether you're young or not so young, it doesn't really matter. And I tell you, when I had my knee replaced, my left knee replaced, for the first few months, I thought, man, was this worth getting replaced? But through physical therapy, and, I've started back just, you said, a tune-up.
A tune-up, yep. It happens.
Yeah, and so it pays off for sure, because, and Evan mentioned this to me the other day, he said, what's in your leg is not supposed to be there.
That's correct.
That's right. It's not yours.
Yeah, it's a man-made knee now. It's
Yeah.
not the knee that God gave you.
Yeah,
That's right.
Yeah, and whether it's a knee replacement or hip replacement, or maybe it's just aches and pains, whether you're an athlete or non-athlete, Evan, that's the way to go, right?
That's right, yeah.
Talk a little bit more, Evan, about your services and what you specialize in.
So I specialize in everything muscle and joint related, joint pain, aching in the muscles. I also work a lot on balance, dizziness, neurological disorders, anything that involves movement, we're professionals in. So
you got a full staff over there, Ben. Talk about that.
We got 2 physical therapists, Dan Shabel and Evan is now with us. So we've got 3 physical therapist assistants. So we got 5 licensed therapists, and of course Kim in the front office. So we are definitely fully staffed.
So if people would like to talk more about the services you provide, how do they get in touch with you guys?
So they can call the office. Kim will be the first person to contact. You can get our phone number 256-487-8040. But to get a hold of that, you can usually get us on Facebook. You can find us on X, all of the social media platforms.
That you're an expert at, right?
Google us. You know, yeah. I don't do the social media, but it is there, and it's good information, and it allows you to get our address, phone numbers, all of that stuff.
Evan, talk about some of the common, whether it's surgical or non-surgical situations that you guys deal with.
Yes, sir. So we see a lot of arthritis pain, obviously. We see a lot of athletes that, have strained muscles, things like that. And like you, after surgeries, so joint replacements, ACL surgeries, reconstructions, meaning like a broken bone, damaged bone, reconstructed. So all your surgeries, all your pains, really.
It's been said that, and I've seen many, many quotes about it, after a surgery, especially like in my case, I didn't really believe it to start with, but that physical therapy is key to getting back on your feet and getting back on your feet the right way.
It really is, and for people that have total joint replacements, it's almost a lifelong commitment because you have to keep the maintenance up on it. So you got to keep it stretched out. You got to keep your mobility. You got to keep your balance, and those are things that you just have to work on from time to time. So that's like you coming back a year later or 5 years later for what we say is maybe a tune-up, just to get you back on track, get all those muscles working in balance so that you can be more functional and have a better quality of life.
It's almost like a car, isn't it?
That's right, yeah.
Keep the maintenance.
Yep, you got to change the oil.
Absolutely, absolutely. Now, this is not just for guys. A lot of ladies come in there, and y'all are able to help them as well.
We do. We treat them all. It doesn't matter male, female, young and old. Everybody has had pain at some point in their life, and probably our biggest body part to treat is back pain. If you've lived life, worked hard, done anything, you've probably had back pain. And the sooner we can see that back pain, the easier it is to correct what you've got and keep you out of the surgery room.
Wow, no doubt about it. Ben Donahoo and Evan joining us this morning as well, opening up a new facility over in Vincent. And Evan, I know you're excited about that opportunity.
Yes, sir, absolutely.
Now, it's going to be opening real soon, maybe in the next month or so. And if folks in that area need a tune-up, or maybe you need some treatment on a bad back, or we can't help you with an achy, breaky heart, but we can help you with a lot of areas as far as physical therapy is concerned. And Ben, the good part about it, people think that it's just for athletes. It's not.
No, it's everyday people. So we treat athletes, we treat, everybody with any kind of ailment, and we take all the insurances. We got cash options. There's something for everybody. So if you're sitting around wondering, what should I do about this wrist or this shoulder or this back or this knee, or you having falls, don't wait. Just come by and see us. Give us a call.
Yeah.
We'll talk to you about it over the phone and tell you what steps you need to take to get back to full function.
Without naming names, either of you can answer this. Maybe a success story that you said, wow, this really does work.
It does. We see it every day. It's a success story every day. People just coming in needing advice on how to fix their ailments. And it's 90%, it's an easy fix. You just got to get the prescription you need for your problem. If it's a back, a few exercises to help fix your posture. Everybody gets a posture lesson that comes in our clinic, and you've been in there, so if you come in the clinic, whether you've got foot pain, knee pain, or hip pain, you're going to get a posture lesson no matter what pain you have. If your little finger's hurting, you're going to get a posture lesson. So everybody's going to get that, because that's probably one of the biggest things we see is posture today with computers, telephones.
Yeah.
The digital age has got people in a bad posture position.
We don't even think about it, Evan, at all. We don't think about it. Talk a little bit, Evan, a bit before we go this morning. What got you going in the direction of a physical therapist?
Okay, so Ben obviously had some take into that. He's, you know, my father, so, and he's a PTA. I was around his clinic a lot growing up. I explored a couple other medical careers, but I wasn't too into, you know, seeing a patient one time, giving them some medicine and sending them on their way, come back in 2 weeks. I really like the engagement with all my patients. I like to see them, you know, twice, 3 times a week, and having that engagement with them, seeing them get better and watching them progress in their life.
All right, right before we say our goodbyes this morning, you touched on something, Ben, I think a lot of people are hesitant about, because we don't like to talk about insurance. We get bogged down, and I'm the world's worst. I don't like to talk about it. I just like to say, here, this is what I got. But insurance is a key too as well.
It is, and that's why we have a great front office and staff, billing staff that takes care of all that, because I'm like you, I do physical therapy. I'm not an insurance guy. So we have people that cover that with you when you come in. You see Kim the first day. She's going to give you all that insurance, what you have to pay, what you don't have to pay. And we'll work through all of that stuff with you and make it as easy, as painless as possible. With insurance, it's difficult.
All right. We appreciate you both coming in this morning. Ben and Evan from Donahoo Physical Therapy, opening a brand new office in Vincent coming up real soon. Guys, thank you both for coming this morning.
Man, thanks, Jimmy Dale.
Got more Daybreak just ahead. Don't go away.